a total of 2,378,171 doses of COVID-19 vaccines have been administered to the population countrywide. The number of people who have received the first dose stands at 1,794,105, while 584,066 people have received the second dose. The vaccination coverage of the priority groups of people who have received 2 doses, that is full vaccination of COVID-19, stands as follows. Health workers, 34.2%, security personnel, 19.4%, teachers, 14.9%, the elderly, 50 years and above, 1.7%, people with comorbidities, 1.8%. These numbers are still too small. With increased availability of vaccines, I urge those eligible to get vaccinated. The ministry would like to reiterate that all vaccines being administered to the population at the designated vaccine sites are safe, effective, and free of charge. I'll now give an update on travel measures. As you may recall, Uganda has been testing incoming travelers with support from the private sector based on categorization of countries. The categorization took into consideration the presence of variants of concern, high rate of transmission of the disease, the number of deaths reported, and vaccination coverage of at least 60%. A request by the Ministry of Health for mandatory testing for all incoming travelers required an assessment of the capacity and premises of the private sector. High costs of testing, prolonged waiting time, and inconvenience by having to travel away from the airport were cited as major challenges that would affect mandatory testing by the private sector. A cabinet sitting of 13 September 2021 directed that government should carry out mandatory testing of all incoming travelers at their own cost at Entebbe International Airport and all other points of entry as a means of preventing importation of additional variants into the country. In preparation for this, the ministry, working with the UPDF Brigade, has concluded setup of the sample collection facilities, testing laboratories, and client flow processes